thank you for coming. And we are doing a series of these seminars, and this topic came up of talking about geriatric pets. And the four of us signed up, I think, because we each have kind of a special affinity for our older animals, and we've each had older animals and dealt with the pleasure of having them, but also some of the challenges as they age. And so we have some personal experience that we really hope to share with you. Okay, so I wanted to just talk with you about how we treat our senior patients a little bit different than our younger patients. We really want your pets to live a long time, but we also want them to be happy and healthy during those years. So we are looking for ways to treat animals and not just accept, oh, they're getting older, that's just part of aging. There actually may be a lot that we can do to help them have a happier and longer life. So we want to look for signs that signal disease and help you know what to look for in your pet at home. We may recommend that your pet come in every 6 months instead of every year for a physical exam. We call this a senior wellness exam. The idea being that as pets age, we want to catch things early. Things change a bit faster when pets are in their older years, and we want to catch those declines early and hopefully be able to treat problems early and get on top of things. So some of the questions that we ask you during that senior pet exam may be a little bit different than what we ask owners of younger animals. We're looking for signs of common diseases that come up in older pets. So we'll ask you things like, is your pet drinking more water than normal? Does he or she seem stiff or painful? Any changes in appetite or energy? Changes in urinations or defecations? And some of these things, when we hear from you, signal to us that we need to look further for certain diseases that are common in older pets. In addition, we're going to ask you about your pet's exposure to other animals and their risks of contracting diseases. We tailor the vaccines here specifically for your pet and based on their risk. And it's not unusual as pets age that we will decrease the frequency of vaccines and sometimes even say, you know, we really feel like your pet doesn't need this certain vaccine anymore because their risk is so low. We don't believe in giving unnecessary vaccines, so we try to tailor it to your individual pet's needs. So some of the problems that we're hoping to identify early and are common in older pets are heart disease, kidney disease, liver disease, cancer, arthritis, diabetes, thyroid disease, and dental problems. So we can screen for early detection by running blood work on your pet, and Dr. Sheehy is actually going to talk in more detail about the types of blood tests that we can do in a few minutes. And we're also able to do things like take digital x-rays. That gives us a nice visual view of your pet's internal organs. It's actually pretty amazing how detailed those pictures can be. And we're able to use an ultrasonic scaler to remove tartar from diseased teeth. And we're fortunate enough also to have specialists in our area that we work with pretty closely. So if your pet's condition becomes a bit more complicated, we have really talented people just down the road in Campbell that we can refer you to as well. Sometimes all that's required to help your aging pet is some changes in the home environment, and we can help you with suggestions there too. And then I was hoping at this point that Martin could come up. So he works at Pet People Pet Store. So it's on North Santa Cruz Avenue. The cross street is Andrews Street, right next to Safeway. Really nice little pet store. It looks small from the outside, but they have tons of stuff in there. And he's going to, show us some things that he brought today and talk about how they might help with your pets.
So everyone's here familiar with Pet People, right?
Yeah.
Right?
Yes.
So for those who aren't, we've been in business here for 26 years. And we're open 7 days a week. On average, we get about 100 visitors, 100 customers a day. So it's very common, almost on a daily basis, for a customer to come in and ask how they can make their environment more comfortable for their elderly pet. So we have quite a few different products that can help with those things. By far, mobility issues seem to be the biggest challenge for cats and dogs as they age. Maybe my kitty Sebastian just doesn't jump up on the bed, as quickly as he used to, and I want to offer him something to help with that. So that's how steps come into play. They come in all shapes and sizes. This one happens to be foam. There are some that are more solid, made out of plywood and carpeting. Maybe they're not the most attractive thing in the house, but they serve a purpose, and that's to make our pets more comfortable. For our older dogs who are used to going for rides as often as possible, maybe they can't get into the truck or into the car as easily as they used to. So there's a series of ramps that are available that can go easily into the back of my SUV or van. Rough surface on there to help give them traction. Some training is involved in this. Back at home, we might also want to look at the idea of their sleeping situations. Maybe they're used to having a big pillow bed that they love so much, or a nice big fluffy bolster bed that they rest their head on. But as they get older, some pets have some mobility issues, and maybe those big fluffy pillows aren't as easy to navigate. So that's where these flat orthopedic beds come in very handy. It's that A-crate kind of foam, which can give very good stability, but also it's a lot more stable surface for your pet to be able to walk on and get comfortable on. Also along in the same area of mobility, for our larger pets, our dogs who are having maybe limb or spinal issues, harnesses can be a terrific help in getting them up off the ground or up onto the bed or into the car. This is a relatively small harness that fits around the front of a dog from a company called Roughwear. It's not designed specifically for medical issues, for debilitating conditions, but many people find this is really helpful. They have handles on to help you lift the dog. Another company that's pretty new to the scene, this company called Help 'em Up. This is a Help 'em Up harness. It actually comes in two pieces. One for the front end. It has a 5-point design, so it spreads out the weight of the dog, and one for the back end. So depending on your dog's condition, if they're having issues on the front end or the back or all over, this can go very far in helping them get up off the ground or navigate steps. Perhaps a harness might not be necessary, but many dogs might still have trouble with footing. I have hardwood floors in my house, and I know when my dogs start to age, getting a grip on the ground can be kind of a challenge sometimes. So there's a variety of different kinds of boots and socks that you can put on your dog. If going outside, it might be a concern, and you want to give them a good grip, there's another set of boots from the same company who made this harness, Roughwear. These are actually big hiking boots with tough rubber surfaces. I gave these to one of my dogs when he was having some mobility issues, because as we go out for a walk, he would drag one foot, and that can cause him trouble on the toes and on the nails. So one of these was able to protect that, and we could still go out for a walk and he would be comfortable. Around the house, there are other products you can use too. This is an interesting little type of booty. Looks like a big rubber balloon, but it fits on your dog's paw like a sock and gives him traction on slick surfaces like a hardwood floor and linoleum.
Did you get much feedback from people on, that the pet's trying to get it off, or it's irritating?
Every pet's going to be a little bit different. Some dogs aren't really comfortable, or certainly not familiar with having things on their feet.
Yeah.
So many will try to tear the things off, or some you'll get their feet, boots on their feet, and they'll just freeze. But many times they get used to it, and it takes a little time, and helping them along, they'll realize that, hey, I can get up again. And this
Maybe
is
putting it on for short increments and then revisiting it.
right. Here's another example of some little booties. These are called power paws. They're actually little socks, but they have rubber on the bottom to help them get a grip on those slick surfaces. But like I said, every dog is going to be a little bit, or cat is going to be a little bit different, and if they aren't used to having things on their feet, it might take a little bit of getting used to. So beyond the mobility issues that we're asked about daily, some other things that people our pets may be dealing with is incontinence issues. And yes, they do have a little hole cut for the tail. These come in all different sizes for all different size dogs. There's another type here of washable diaper that can help with the same situation. So these are washable. So that's always an uncomfortable situation both for you and the dog. But there are some options to be able to deal with those things. Raised feeders, I think, was mentioned on this handout here as a way to make things comfortable for your dog's eating habits. Some types of medical conditions, maybe some neck issues or a condition called megaesophagus, requires us to feed our dog at a raised height to make sure that food takes a shortcut right to the stomach. So raised feeders comes up pretty frequently too. So that's an example of some of the different types of products that are out there that can help us when we're really trying to keep the quality of our pets' lives up and going as long as we can.
Yeah, thank you, Martin. And again, he, at the end of the talk, has invited anybody who wants to come up and check out these products a little closer. It's fine if you want to touch things and check them out. I would like to address some other things that you can do on the preventive side of things for your senior pets. It's important to keep up their dental care. So options are teeth brushing, and we have different size teeth brushing kits for cats all the way up to really large dogs. There are special chewable treats that have enzymes in them that help break down the tartar and keep bacterial counts down, so that's helpful as well. And then we have a product we haven't been carrying that long, but it's called Healthy Mouth. It's an additive for their water. It was recommended by the veterinary dentist who practices up in the North Bay, and we've gotten really good feedback from our clients on that, and that's probably the easiest one to do and is helpful in terms of helping oral hygiene. Maintaining your pet at a healthy weight is really important, so we have both spectrums with that. I would say dogs, probably more commonly as they age, we see problems with them becoming overweight. Their metabolism slows, they're maybe getting less exercise and putting on some weight, and it's really important for their joints and mobility to keep them on the leaner side, so we can help make recommendations on how to keep them at an appropriate body weight. For cats, I'd say it's more common as they age to see problems maybe with weight loss. So again, we can help you with adjustments to their diet and look for any signs of decreased appetite, to look for underlying problems as to why they might be losing weight. There also are special diets formulated for pets as they age, depending upon their medical conditions, so we can help you with recommendations in that area as well. And I would say giving your pet regular exercise is really important, and you may need to adjust how that exercise happens as they age, but it's not only important for their muscle tone and mobility, but also just mental stimulation. Getting a cat to play a little bit and pounce around, or getting a dog outside with smells and the stimuli that come with that is important for their mental health. So there are supplements and medications and other therapies that can help if your pet is starting to slow down. And that also is something that Dr. Sheehy is going to get into a little bit more in detail. What we'd really like is to be able to assist them being more, as comfortable as they can be, so that they can get the exercise that they need. sometimes there's this spiral where if they're arthritic or stiff, they don't want to walk as much, so then they become more immobile, and it's kind of this spiral that happens that's not a good cycle to get on. So we want to try to keep them moving as much as possible. Another thing that may be just super simple is keeping your pet's nails trimmed appropriately. Again, if we're seeing them twice a year, we can help with that. Senior pets tend to wear down their nails less because they're just doing less activity and may need more frequent nail trims, so we can help you with that. So Kevin Sheehy's going to come up and he's going to talk with you about medical testing, blood testing that can be done on your pets, and also pain management for senior pets.
Thank you guys for sharing your Sunday with us. Yeah, so we spend a lot of time trying to do what's best for our aging and animals, and so when we realize when we're in the exam room we only have 15-20 minutes to talk about some of these issues, and so we oftentimes have a nurse come in and ask questions, and the doctor will follow up with questions, and we don't try to be redundant, but especially for an aging pet, that sometimes it's the attention to detail that I think is important. So we'll ask you questions about specifically, I think routines are very important as animals start to age. And what I mean by that is that some animals will, their sleeping patterns will change, their water consumption, their appetite, their routines during the day will oftentimes change. So when we ask these questions, we're not trying to be, again, redundant, but we're trying to get out a little bit of details that may help us decide what we're looking for to help the pet live a long, healthy life. So when we talk about every 6 months, you realize for our life, 6 months goes by really quick, and for a dog or a cat, that 6 months can translate into quite a bit of their lifespan. So we oftentimes recommend doing some screening blood work, both with cats and dogs. A very common thing that we ask for is what's their appetite like and what's their water consumption. Those are two big drivers in some of the metabolic things that happen both with people, cats, and dogs commonly. So what we recommend in this blood test, because it's blood and urine is very minimally invasive, you're checking the basics. So we're checking metabolic function, so liver function, kidney function, thyroid function, and also when we look at the urine, we can actually tell a lot about that. Is there infection going on, low-grade infection that could be compromising their health, and also how is their liver and kidney function okay, and metabolically speaking, is there something that's compromising that? So the big three that we try to rule out with that blood test, which blood and urine test is minimally invasive, is so diabetes is a big one, so we worry about that with people, and also both dogs and cats is very prevalent. So the most common scenario, drinking a lot of water, urinating a lot, and sometimes they'll have actually a really good appetite. So as pet owners, we see that as a positive. They're eating great, they're drinking great. We want to catch that a little bit early on in the process, so maybe we can modify their diet, maybe we can modify things before they get ill. I know the doctors talk a lot in meetings, both dogs and cats are good maskers of illness. As you guys all have pets and have seen them even age, they don't show us right off the bat that they're sick. They do everything they can to hide that illness from us, and that goes back a little bit to their overall pack mentality, is that they're not going to show the first signs of illness, versus you and I, we're going to say, hey, I don't feel good, I'm feeling lethargic. Cats and dogs both share that commonality, and so we oftentimes recommend this blood screening, or metabolic screening we call it, to catch early signs so we can manipulate diet and maybe treatment and preserve those organs functioning, both the liver, kidneys. So when you were asked to come in every 6 months, we're also looking at what their weight's like. Have they lost weight? Have they gained weight? So the big commonality or the difference in cats and dogs is metabolically is with thyroid. People, our thyroid sits right around our Adam's apple, and in dogs they suffer from low thyroid disease, and cats actually have hyperthyroidism, so they have an overactive metabolism. So what we see in both cases in dogs, that they will actually be sometimes what we kind of chalk up to showing their age. So they will be a little lethargic, maybe not being as active, maybe gain a little bit more weight. And what we'll do is we'll check a thyroid level to see is there any metabolic reason for that lethargy or weight gain. In cats, it's a little more tricky. Cats are actually hyperthyroid, so their metabolic rate is sped up. So what we see is that they actually have more energy, they're drinking a lot, eating a lot, but over time they start to lose weight. And one of the big differentiating factors is that cats they will start to become more vocal. So they'll start talking at night and crying, and that's because their metabolic rate is sped up. So if we listen to their heart rate's twice the rate it should be, and we also see that they've actually lost weight if we haven't seen them in 6 months or a year. So some of these questions we're asking about water, food, are based on those metabolic things that we can correct or change. Okay, and then the other process that I'd want to talk about is, and Martin and Dr. Reynolds talked about, is mobility. I think mobility is an increasingly, anybody that's had a geriatric patient or animal realizes that sometimes that can affect their quality of life. And so getting up, doing those normal routines that I talked about can be very important for them, whether it's jumping up on the couch with you every evening, or whether it's getting outside to go to the bathroom on their own. Those things are important. So we do have quite a few supplementations that we even have samples today, and even Pet People's been really good about helping to carry some of the products that we endorse, not only here, but you can find over the counter. The two things that I often see in terms of arthritis or mobility issues is that a two-tiered process. One is pain, and then one is inflammation as well. Mm-hmm. And we oftentimes see that, again, with dogs and cats, a lot of them don't vocalize and cry like we would, aches and pains and stiffness. So we're asking a bunch of questions on how do they get up from a down position? Do they follow you around the house like they used to? How is it getting in and out of the truck? Are they sitting up on their kitty stand like they normally do? Are they jumping up on their favorite chair? Those sorts of things. How are they doing on those long walks? And not so much how they doing on the walks, but how's their recovery? So if they're only going out on the weekends and they're happy to go for a long walk on the weekend, well, how are they on Monday morning? Are they suffering the weekend warrior pain and inflammation? Are they stiff after they've overdone it because they want to please us? So the pain and the inflammatory process can coincide and work in both of those angles. We do have some supplements, both in the Western medicine. There are some great anti-inflammatories that can help decrease inflammation and also help for pain. So we'll oftentimes use a multi-pronged approach in terms of something that can decrease inflammation, also help for pain. We've hired a Eastern medicine trained doctor that can also add in decreasing inflammation, which is a big component to some of these chronic arthritides and pain. So acupuncture, we have a laser therapy that can actually coincide with that, along with teaching you to do certain exercises, active range of motion, ice packing, all different sorts of things that we can help. There's hydrotherapy, there's underwater treadmills, there's actually physical therapists for dogs that we can refer you to, where that's what their full-time job is, going through teaching you exercises on range of motion, massage therapy, icing, exercises that can strengthen your dog's muscles, the ones that are there, and like Dr. Reynolds said, to maybe alter their routines a little bit. So really important to keep them flexible, keep them moving, but maybe find that limit of, rather than walking them an hour, it may be worthwhile getting them up and walking 20-30 minutes 3-4 times a week or daily versus 1 or 2 hours on the weekend. And I think what we see from doctors is that especially dogs will want to run and they'll keep up with the owners as long as they go, but they won't give us that clue that they're hurting, until we find out, boy, they really can't jump up in the truck or they're not mobile. And so a lot of our questions again are asked, trying to decide what's best for your patient. And the better chance we have of helping you out is more often we see the pet. How do they respond to the acupuncture? Did they respond to the joint supplements? Let's try them on a little anti-inflammatory and see, does that change that routine of you guys walking 3-4 times a week? Or is the recovery better? Can they get up, get around the house, get outside to go to the bathroom, those sorts of things.
I did want to address, how to know when it's time to let your pet go. Because I know that as we have these aging pets, that can be something that kind of weighs on our hearts and can be a difficult decision. And I just want to make sure that you know that we are all here to help you with that decision and support you. And we've all been there ourselves and know how difficult it can be. So I just wanted to say a couple things about that. So we're really open to an open discussion about it, so don't be afraid to ask for our help or input with these types of questions. We may ask you back some questions to just try to help assess your pet's quality of life. Questions about signs of pain that you may see, your pet's appetite or demeanor, their ability to move around, are they able to do the things that he or she enjoys? And we just want to help determine, when it might be appropriate to consider euthanasia for your pet. I did want to tell you that we do house calls, and sometimes that's a really nice alternative for people who don't want to bring their pet into the hospital for that procedure. And we always invite you to be with your pet during the euthanasia procedure if you want to be, so we're very open to that. We have information on grief counseling, a nice packet that we've put together, and we also have a library of some children's books to help kids deal with those feelings of loss as well. So, we're here to support you and your furry family members, and don't be afraid to reach out to us if you're thinking that possibly, you're facing that decision.
I went through with one of my dogs, someone put, what does pacing and circling done by my elderly dog mean? And when I went to school, I learned about cognitive dysfunction syndrome in dogs, or canine senility, and same thing with cats. And one of my pets, actually, I was fortunate that she lived long enough that I actually saw that. So sometimes pacing and circling and wandering, those can all be signs of losing some cognitive ability. So some pets, as they live long enough, they can lose cognition just like we can as well. And that's where the importance of routines come into play. I talk about that a lot day to day. So oftentimes as a pet is losing some cognition, they will start to pace and wander without a plan. They'll circle. I call it doing laps. They'll sometimes in the house they'll have a certain pattern that they'll go through and make little laps around the house. So they'll ask to go outside, and they'll go outside and stand out in the grass and then go, why was I out here again? I don't exactly remember. And sometimes they'll spend a lot of times out there, and then they'll come back in and then urinate in the house when they've had access outside. And for us as veterinarians, that signals that there may be some cognitive problems that are starting to creep in, but it also can be anxiety. As some of the pets are, as some of our animals are getting older, they get real focused on our routines, and so we ask about how's your pet's routines, but they get really focused on where's mom, where's dad, feeding schedule, things like that. So as they get a little bit older, some animals really get focused on that. If an owner leaves town or they change the feeding pattern, that can really throw some of the elderly geriatric patients throw their world off to where they get really anxious with those change of routines. They want to be fed at 5 a.m. and 5 p.m. They understand time changes better than we do.
Yeah.
So those things, as they get older, sometimes anxiety can play a role in those change of routines. And I oftentimes recommend pet people, not because Martin's just sitting here, but they do take the time to teach their staff about the diets, even more so than as you've seen a flood of different diets on the market. It's hard for me to keep up to speed on every diet. People will come in and say, I'm on this diet, and I'll go, oh man, now I gotta go look at another diet. And there's been a flood in the market, and I think they've done a really good job of training their staff and be knowledgeable. So when we defer to them, we know that they're probably doing a little bit more about what's the latest and greatest diets and what they have and don't have in them. And if you don't mind, I'm gonna try to knock 3 of these out at once, because they all kind of ask the same thing. And it's about supplements, so, and about diets, and one of them asks about, is there anything we can do for arthritis? What about proactively we can do for mobility and joints? So some of the basic ones I'll talk about, the ones you hear about, glucosamine and chondroitin, you see now in the stores, you see a huge, any Walgreens or any pharmacy, you see a huge section on what I call joint supplements. So the problem with the good and the bad is that there's been lots of studies that have shown in people that that they've shown some great benefits to arthritis, whether it's wear and tear or degenerative joint disease, which we call arthritis, or rheumatoid arthritis. And so you'll see this argument kind of like, is coffee good or bad for you? You'll see every once in a while you see these articles, glucosamine doesn't do anything. Maybe it does, it helps me a lot. I always tell people that in dogs there's no placebo effect. They either seem, cats and dogs, they're either better or they're not. And so I recommend usually trying one of these joint supplements and seeing over a 4-week period how are they doing on their walks, how's the recovery after the walk, are they more active in the household, in the kitchen. So we here, since there's a flood out in the market, we choose 2 products that have gone through testing to say what's in here is appropriate and has been studied. The problem with some of the over-the-counter ones is that it falls in the USDA and FDA as a nutraceutical, which means that no one regulates what's in those products that are over-the-counter. So that's why you see a whole row of them, and they all vary in price. Some are super expensive, some are reasonably cost. And the Journal of Rheumatology, the Human Journal, actually every once in a couple of years they take off 10 or 20 of those products and they actually analyze those. And the results are always out there, consumer reports you can look at for people. And sometimes the most expensive one, they don't have any of the product that is guaranteed in there. But no one's regulating those over-the-counter, what's called nutraceuticals. So you just gotta be careful about what you're using. Not that it's gonna be harmful for your pet, but you may not be getting the benefit from that. So I always recommend try one product. If that works well, great, then stick with that. If it doesn't work, then maybe circle back with us and we'll recommend a name brand formula. Let's try that for 4 weeks and see if that makes a difference. And the other product that you hear a lot of is fish oils or essential fatty acids, both for people and for dogs. And there's been some pretty extensive testing in people and also dogs that increasing essential fatty acids in specific ones, 3, 6, and 9, or fish oils, can decrease inflammation both for heart disease, arthritis, skin conditions. So again, trying to hit that inflammatory cascade. So we carry a couple of supplementations here, and you'll see in Whole Foods or the natural foods or even any of the pharmacies, you'll see the essential fatty acids supplementation. If they're not causing digestive issues and you're able to get into them, that's into their food without a problem, then that's something that I always recommend, and the doctors usually recommend, because it can serve some benefit too.
As they're aging. Probably the number one thing that can be done on the preventive end is to keep your animal lean through their younger years. Just less load on their joints over time will delay that date at which they're starting to have problems with arthritis.
Like Dr. Reynolds said, there was a really impressive 10-year study that, well, now has come out like 5 years ago, but we used to think if a dog had hip dysplasia or congenital problems that was it, that's what they had, we had to manage it. And what we found, or what this study found, is they had a group of Labradors that were born with hip dysplasia, and I think elbow dysplasia, and they separated them at birth, and they gave one to a control study to a family that said you need to feed this amount of food, and we need to see you back every 6 months or every year. And they followed these dogs out from puppies, and they followed them all the way out to the end of their career. And what they found was that keeping them in lean body weight actually changed the genetic expression of their hip and elbow dysplasia. Whereas before we thought, that's a bummer, we have to manage their condition. But actually keeping dogs in leaner weight will actually change. They found that the dogs lived 2 years longer in general that were in lean body mass. And when they x-rayed their hips out at 8, 9, 10 years of age, they found the degree of arthritis was markedly less in those dogs that were in lean body mass. So we talk a lot about that in the exam room. Let's keep them lean after surgery or as we're getting on in their years. Let's make sure they maintain that lean body mass throughout, especially their geriatric years, so it's less burden on their joints, less burden on their heart, that sort of thing.